Your support helps us bring you programs you love. Go to wyomingpbs.org, click on Support, and become a sustaining member or an annual member. It's easy and secure. Thank you.
Good evening, I'm Craig Blumenschein from Wyoming PBS. We want to welcome our viewers to tonight's discussion on dementia and Alzheimer's in Wyoming. It's an important conversation, and we'll learn many things tonight, including the fact that many Wyomingites and Americans really may have Alzheimer's but have yet to be diagnosed. What is Alzheimer's and what is dementia? We'll discuss those issues and more with our panel of experts tonight in this special Wyoming Chronicle Live. During tonight's show, we encourage our viewers to call in with their questions. We have phone operators who are standing by right now, and they'll get your questions to us. You can call right now again at 1-800-495-9788. And you can also email us your questions right now at alzheimers@wyomingpbs.org. Before we begin our discussion on what promises to be a very interesting topic, a tragic disease, I want to introduce our panel. Dr. Kara Johnson is a doctor of osteopathic medicine. She practices in Cheyenne and specializes in geriatric medicine. Stella Montano is from Sheridan and is the family caregiver director at the Sheridan Senior Center. And Linda Chasson is a program manager in the Wyoming Home Services Program. The Wyoming Home Services Program is used to provide services to those qualified individuals who are at risk of premature institutionalization. To my panel, welcome, and thank you very much for joining us tonight on this special Wyoming Chronicle Live. Linda, I would like to start with you. Just set the table for us.
Sure.
How many people in Wyoming are maybe impacted by Alzheimer's and dementia?
Well, let me begin by saying in America, there's about an estimated about 5.3 million Americans that are diagnosed with Alzheimer's. That equates to about 1 in 9. But in Wyoming, we estimate to be about 9,100 people that are currently diagnosed with Alzheimer's.
Wow. I mean, how do we collect that information? What is the tool that you use? How do we know if those numbers are accurate, or is there a fear maybe that those numbers are underreported?
I think that it's accurate to say that they're probably underreported. Wyoming does not have a registry that collects the prevalence of Alzheimer's in Wyoming, so it is an estimate. And oftentimes when information is recorded through insurance information or what, but it's oftentimes very underreported. So really to know exactly the number, you'd have to have a registry of some sort that would collect that information.
I think as we begin tonight, we want to show a video to our viewers. The title of the video is "Understanding is the Key to Help."
My wife's Alzheimer's, we diagnosed it very early because we had the experience of my mother. And I knew from behavior, not forgetting as much as just general behavior, that there was something seriously wrong with her. She kind of gave up. She stopped cooking, you know, and it just progressed over the years. It got worse and worse. The clinical trials were important to Betty because she said, I have to do this. She said, and she told me, I don't think it's going to help me that much, but it may help somebody else. And I wanted to find a cure for this thing. I've already lost my mom to it. And now each day I lose my wife. My wife goes away a little bit every day. If you're going to understand what your partner or your mother or your dad's gone through, you need to understand what the disease is. We all deal with the anger, we deal with the lack of attention, with sometimes hygiene issues, all kinds of things. You know, the problems have a lot of commonality. You know, they're unique to you, but they're certainly not unique to the Alzheimer's world. Today is the best she's ever going to be. She's not going to be better tomorrow. She's not going to be better next year. You know, it's just one of those things, you see it and then you deal with it. She loves the Orioles. She doesn't know the score. She doesn't know who they're playing, and she often cheers for the other team, you know?
Again, we want to remind our viewers that if you have questions, our expert panel is here to help you tonight. Give us a call at 1-800-495-9788, and our operators will answer your call and they'll get your questions to us. Dr. Johnson, let's define really what Alzheimer's is. What is Alzheimer's and what is dementia?
Okay, that's a great question, and I hear this a lot from people. A lot of times the term dementia and the diagnosis of Alzheimer's, they're kind of used interchangeably. So actually, when we step back, when you break down the word dementia, the DE part means without, and mentia means mind. So anything that is a change from baseline in cognition can be classified as a dementia. Dementias can be temporary, they can be permanent and progressive. It's an umbrella term to encompass lots of different processes where cognition is impacted. Alzheimer's is one of those subsets in a type of dementia that's very specific and has a very specific pathology, or the disease process is very specific. So when we talk about Alzheimer's, it's a very specific process of memory loss that is progressive over time. And in all actuality, Alzheimer's itself is considered to be a terminal diagnosis. We know that people will have Alzheimer's, and through their as they progress through the disease, they will eventually come to an end stage. And it's a fairly predictable course, and we do have very predictable signs that we would see, you know, if we were able to look at someone's brain, if we were able to look at the tissue, and we'd be able to say, hey, this is an Alzheimer's.
But it is a case today, really, that the specific diagnosis can't be made until after a person has passed. Is that accurate?
Yeah, usually that's the thing, but we have enough, there are enough cardinal signs that we see when people have Alzheimer's that we can, with fairly good certainty, say this is definitely Alzheimer's, as opposed to something like a vascular dementia or a Lewy body dementia. They have very specific signs and symptoms that come along with those particular processes.
And we'll talk a little more about the science that is emerging a little bit later in the show, but Stella, I wanted to turn to you. You deal with folks directly who have dementia and Alzheimer's. What should families understand about care?
Well, the first thing I think caregivers need to understand that the person that they're caring for is still that person. It's just that their brain is changing, but they're still that person. It's very difficult, I find, in my caregiver support groups, spouses, that people don't consider themselves caregivers. They consider themselves just a husband, just a wife, a son or a daughter, and so it's very difficult for them to see and understand what these changes are what's happening to their loved one. So by the caregiver accepting support in any way they can, whether it's respite support, any kind of support, it lets them be able to deal with all of these changes that are going through.
If there's a viewer who's watching right now and has been thinking for the last several days, several weeks, several months, that my spouse may be becoming impacted by something because things are a little bit different, what should they do right now? Where's the call they can make? How do they reach out? Different communities in Wyoming have different set of supports in place, and quite frankly, some communities don't have any support at all. What's someone to do?
Right. You know, I would say the first thing you would do is see your physician, but if it's a spouse, it's very difficult sometimes to say, you know, you're really changing. We got to go see a doctor. That's probably not going to happen. So the only thing that caregiver can do is do something for themselves. So I get a lot of calls where I work at the senior center in Sheridan from caregivers, and I usually invite them to sit with me or come to a caregiver support group meeting where they find immediately that they are not alone, and we start helping them, that caregiver, what they can do. Because truly, especially if it's an early onset, people don't sometimes seek medical care for a long time. And if it's an elder, you know, it may just be, people think that that's the norm, and it's not.
I would like to kind of go from what you're saying.
Okay.
A lot of times who comes to me in my practice is actually often adult children. We'll be bringing in mom or dad, and with the caveat that something's wrong. And a lot of times, what I've seen with different families is you have a couple that's been married for quite some time, husband and wife, and let's say the wife has memory problems, but the husband has been kind of helping and covering and kind of coaching as things go along. So let's say
Covering, is that denying?
not really
Is that
covering,
denial,
but just
or-
kind of helping and kind
Okay.
of not wanting to distress their spouse that there's something wrong. So a good example, we have Mrs. Smith and Mr. Smith, and Mrs. Smith used to love to bake, and she was a proficient baker. Now she still wants to bake, but now she's not sure where the pans are. She doesn't know where this goes. And you'll see Mr. Smith saying, oh, remember, honey, the pans are there. Oh, remember, you're going to do this, and giving some prompts. And then kind of what will happen is either the children will notice something's going on and bring their mother in, or Mr. Smith passes away. And the children all of a sudden are like, we never realized that mom's memory was this bad. And it was because the spouse had been kind of propping them up and helping them and kind of easing things along. And it's just a more dramatic change once that constant is out of the picture. So definitely I would say if you suspect that there's something going on with someone's memory, the best thing, get them to their primary care doctor. Or if we're wanting to know about resources or things statewide, you know, the State Alzheimer's Association does have a website. There is a comprehensive list of signs that we look for that are suggestive of a diagnosis of Alzheimer's disease. And the hotline that they have can help direct people to resources that they need.
And we're showing those resources on the bottom of our screen throughout the evening. We encourage our viewers to make that call. To, if there are any questions or concerns, better earlier than later.
Mm-hmm. Definitely.
We've had two questions called in this evening, and they're both related. My mother and two of my sisters have Alzheimer's. What are the chances of me getting Alzheimer's? And another question is, Alzheimer's hereditary? What do we know?
So what we know is that there's still a lot we don't know. We do know that there is an ApoE4 gene that, if it is inherited, will increase your risk of having Alzheimer's. The funny thing with genetics is a lot of times you can see things run in a family and that it'll skip somebody. So you can't say with 100% certainty if all the female family members have it, then you're going to have it as well. We do know that the risk of developing Alzheimer's increases as we age. So as we get older, our risk goes up. We do know that women tend to be more affected than men are. And again, is that a genetics thing, or is that because women tend to live longer, and we're not quite sure. Anybody that I care for who, if they've got Alzheimer's and it seems like there's family members with it, I will always talk with their adult children of, you know, there is a possibility that this may be something that you will have later down the road, but you never can say for 100%.
Are there tools available to allow for early detection?
We can screen.
How does that work?
Well, if people come in and let's say they've got specific complaints of a memory problem, most primary care physicians and primary care providers can do an initial screening assessment. We have different tools that are out there that are available that we can use to kind of detect, hey, is there something going on here cognitively? The problem is that there's other things that can mimic dementias, things like very bad undertreated depression, undertreated hypothyroidism, B12 deficiencies, alcoholism. There's kind of a whole list. And so if there's any questions, we can always refer people to a neuropsychologist to do more formal testing as far as the cognition. In addition, we'll look at lab work and sometimes brain imaging and kind of put together the whole puzzle.
And would you say, Doctor, that those services are available all across Wyoming?
You're going to see the bulk of those services in your big towns. So, you know, Casper, you know, Cheyenne, probably Jackson they have some memory-directed care up there as well. When you get out into the smaller, more rural areas, that's when you're not going to have those resources. So the next step is going to be looking, you know, which is the next town that you can get to be able to tap into those, get those diagnoses.
Linda, this is a good lead into the next thing that I'd like to talk about.
Sure.
There's work undergoing for a statewide Alzheimer's plan.
That's correct.
But Wyoming is one of the few states that doesn't have a plan. So what's happening, what will be happening, and if people want to participate, how will they be afforded the opportunity?
Exactly. Well, the state Alzheimer's plan is going to help inform legislators, interested parties, and others as to what the real needs are in Wyoming. And so I've been tasked to facilitate the process of developing a state Alzheimer's plan. And we have a statewide group of individuals that are contributing to the work of developing the plan. And in one way in which we can help begin the process is beginning to formulate the development of hosting stakeholder meetings or town hall meetings across the state. Our work group has identified through asset mapping, which really represents population-based or looking at a population density of individuals 60 and older, to look at those communities that are rich with that age group of people, to conduct town hall meetings where we will ask specific questions in each of those communities. And we've already identified the communities that we want to go to. We plan to have a facilitator that will host the meetings and ask these questions. They'll be recorded, it'll be analyzed, and then we'll develop a report that will go into the plan that really says what Wyoming communities feel that they need. And so the communities that we'd like to address will be Casper, Cheyenne, Cody, Gillette, Guernsey, Jackson, Lander, the Wind River Indian Reservation, and Worland, and Rock Springs, of course. The types of questions that we're going to ask, and they're going to be just simply 3 questions that we want to put out to town hall participants, are what supportive and healthcare services are needed in your community? And as a caregiver, because we're hoping to get lots of caregivers at these meetings, what are the most critical needs you face as someone who provides care? How could these needs be better met? And third, what assistance and supports are most important to you, your family, and other caregivers? If we can get some inclination or some insight to those questions, it really will help us define what our needs are. From that, then the plan will then be circulated and around. And if for those that want to participate will come, we'll be promoting the locations exactly of those town hall meetings and when we're hoping to have these conducted sometime in January, early February. It's most likely that they'll be at those local libraries in those communities. And we've picked those communities because they have high populations of folks that are 60 plus. And that's where we need to be. And if folks aren't part of those communities, but they still want to be a part of it, there'll be an opportunity during the period of time that we're conducting the town hall meetings on probably the Alzheimer's website or the Department of Health's website, where they can answer questions and fill out a survey so they can participate.
Too.
Yeah.
I assume that one of the main things that might be heard out of these meetings is the need for respite care.
Yeah.
Stella, you're very familiar with that, with the day programs you operate in Sheridan.
I am.
I would argue that our representatives from Cheyenne and Sheridan may have the best resources available to support. But let's talk about respite care. What is it, and why isn't it available all across Wyoming?
Well, respite care there's always a shortage because there's a shortage of people to provide it, whether it's private respite or in a facility like a home care setting. At the senior center, we have settings where we can send out certified nursing assistants, but the programs, I mean, we're limited. People qualify for some programs. We're very fortunate that we have a VA hospital in Sheridan, and the VA is very supportive of veterans and families and supports that way. We have an adult day break associated with the senior center, but they're an 8 to 5, which is wonderful. I mean, 8 to 5 to have respite for your loved one is great. But what happens, if you're a caregiver 24/7, sometimes you need that care in the evening. I mean, you might just need to go to a meeting. You might want to just take a break in the evening. And if that's not available, it's just something that's really difficult for families. And I really wanted to mention a while ago that Dr. Johnson was talking about families coming in and bringing their loved one in. Right now, around the holidays, when people start visiting loved ones, we get an increase in calls from families. And I can go back to personally remember when I visited my folks in Utah, and would wonder, well, what's going on with my mom? Because that's when families notice that something's going on, and that's when they start calling and wanting support for them. One of those things is respite. I mean, if you needed support for your mother or your father, whichever one is the caregiver, it's very, it's important to have that. I think knowing resources, if a caregiver doesn't know where to turn, call a senior center, call somebody that they can think of, maybe even someone at their church can guide them, because I think navigating that system is very, very difficult sometimes. People don't know that extended care facilities, nursing homes, assisted living facilities, they provide respite. At least they do in Sheridan, and I'm thinking that probably in Cheyenne as well. And a lot of people don't know that. So if a caregiver needed to go out of town for an emergency, there's an overnight place that'll take their person.
In some communities.
In some communities, right.
Linda, this is an issue you're dealing with tonight.
Yes, I am.
You're dealing with a family member, your mother.
My mom.
Tell us
she
about
lives
that.
with me. She's 98, and she's been an active senior most of her life. It's just been the last couple of years that she's has been just more at home. She's been active as a foster grandparent in the past, and she had to have some surgery, so that kind of took her out of the circle of a lot of socialization and lots of activity. But as a caregiver, I think it's important that, one, caregivers do get a break, but it's important that you have the right caregiver that's with your parent or with your loved one. It's difficult to find people that you're comfortable with and who the individual, the person with dementia is comfortable with. I mean, oftentimes they're not comfortable with strangers that they don't know. And so, I've called on a personal friend tonight to be with my mom, and just to make sure she's, had dinner, and she doesn't require much, but it's just a little bit of coverage that makes her feel comfortable and that she's safe. And, it just eases my mind that I have a friend that I called on that was able to help me. And it's not always that way, but tonight was pretty special to be here because it's a privilege to talk with you and share our stories. And so, it is hard sometimes.
We had to quickly do.
I was just
go
going to
ahead.
say, I mean, what the big thing that we're hearing from Linda and Stella is caregiver, care for the caregiver. And when I think a lot of people can say very cavalierly, oh, you're just taking care of your mom. It's not that big of a deal, without really understanding what a full-time job it is to care for somebody whose memory is not good. This is someone who raised you and nurtured you, who may have periods of anxiety or paranoia, who may lash out at you, who may refuse to take a bath for days on end, who may be having issues with urinary incontinence and maybe they're trying to get out in the middle of the night, they're leaving the house and wandering. There's a lot of very scary things that can go along with this. Some people can have Alzheimer's and they're happy and never have a problem. And it would be beautiful if that was the case for everybody, but if that was the case, we wouldn't need care centers and nursing homes and caregivers. So the first thing is that caregiving itself is extraordinarily stressful. And if people are trying to care for their loved one and not getting a break, not being able to take care of themselves, go to a doctor's appointment for themselves, go walk around Barnes & Noble or go get a coffee or something to recharge their batteries, the chance of burnout is much higher. We know that people who have dementia are at higher risk for elder abuse. We know that burned out caregivers are at higher risk for maybe accidentally maybe causing some of that. So we want to make sure that our elders are cared for, that our people with cognitive problems are cared for, but that their loved ones who are caring for them have that break. And I think it's wonderful that you guys have day centers, and I wish we had day centers all over the state, because it's a great chance for a loved one to, for you to take your loved one and they're in a safe environment, they're supervised, their activities, they get a meal, they get to socialize with others. But in the meantime, the caregiver gets to go take care of themselves. And I wish we had more resources like that in this state.
Just real quickly, it's safe to say the 9,000 folks that may have dementia or Alzheimer's in Wyoming, that number's not shrinking.
No, it's
Right.
going to continue to
It's going to continue to grow. This leads into a question called in from a viewer from Cheyenne. where are our resources? Is there counseling and education available for family members caring for a relative with Alzheimer's? And I'll take that one step further to maybe learn best practices of caring for a family member that has dementia, that's experiencing Alzheimer's. Where do they turn to know that they're doing the best that they can?
The University of Wyoming Center on Aging has excellent resources for individuals, families that can get additional training on how to manage someone with dementia, but also how to see the signs of early dementia. But the resources that the Center on Aging is excellent. They've got DVDs, all kinds of materials that can help caregivers learn better ways in which to manage and handle the stress. But tricks of the trade, I guess. You know, I think examples of when, you know, someone that would see an ad for Thanksgiving and say, well, gee, you know, it's Thanksgiving, we need to get ready, you know, and the caregiver would really need to say, you know, well, who are we going to invite, instead of trying to correct the individual and say, well, Thanksgiving's not until another week or another 2 weeks, but to divert it. And so it's tricks like that and just ways in which you can divert, because someone with dementia is not going to have the sense of time or understand, well, it's not until, you know, 2 weeks from now. They think it's right now.
Yeah.
And so that's what's important, because it's right in front of them. So University of Wyoming Center on Aging has great resources. Their website gives all kinds of amazing information.
There are best practices.
There are.
Yeah, there are best practices. One book that I actually stock in my office, and when I give the diagnosis to family that, yes, your loved one has Alzheimer's, there's a book called The 36-Hour Day that is a wonderful resource. You can buy it on Amazon, any local bookstore, that really explains the disease process. It explains why certain behaviors occur. It explains here's some ways to deal and some strategies to deal with that. And I think it's a wonderful resource that's very easily obtainable to anybody in the state with it. You know, again, if you've got an internet connection in Amazon, you can get this book.
Can I just say, I keep those books on hand, and you know, I do 2 support groups a week for caregivers, and it's not necessarily just for dementia or Alzheimer's, but a lot of people that are caregivers are dealing with that. But I just give those to caregivers because it is so important. It's like a reference Bible for somebody, and they come back the following week and they say, oh my gosh, you know, they feel like they're not alone by reading that, because they feel unique, that they've never experienced that.
Exactly. And I know that the State Alzheimer's Association as well does sponsor talks and little symposiums and things. I'm not sure, you'd have to kind of check in each community to see where things are occurring, but there are some caregiver support groups that are starting up, and there are lecture series and talks that are put on by the Alzheimer's Association for caregivers to kind of help with tools and things to try to deal with some of the issues that come up.
I want to remind our viewers we're about halfway through tonight's show, but there's still time to call with your questions. Again, that number is 1-800-495-9788. Our operators are ready to take your call right now. And you can also email us your questions to alzheimers@wyomingpbs.org. We've had another question from a viewer in Casper. How does dementia with Parkinson's differ from Alzheimer's?
So this is interesting. So again, this goes back to our definition of dementia being kind of an umbrella term and things being different categories being underneath. So it's kind of, I'm not sure if they're talking about Lewy body dementia, but we can break this down in that there's Alzheimer's disease, dementia, which has a certain pathology. And then there is Parkinson's, which affects a different part of the brain and has some motor abnormalities, things like tremor, the way people walk, and stiffness. People with Parkinson's can, over time, develop dementia over time. And then there's kind of a mixed dementia in the middle that's called Lewy body dementia, where you see some of the signs, some of the cognitive signs associated with Alzheimer's, but with some of the movement abnormalities we see in Parkinson's. And then there are some other subset things that are seen in that particular type. So what it comes down to determine which one it is is just a physical examination and evaluation by a physician, and that can kind of point you in the direction. Interestingly, we know that Alzheimer's follows a very predictable course for the most part. We know that Parkinson's itself can follow kind of a variable course depending on if it's an early diagnosis or a late diagnosis. Oftentimes, if you're diagnosed with Parkinson's later in life, you have more memory loss associated with it, whereas if you're diagnosed earlier, you have more motor abnormalities. And then the Lewy body dementia kind of does its own little thing in the middle there, and it's kind of a mix. So.
We've talked a little bit about this viewer's question, but I want to read it because I think it echoes probably the frustrations that many caregivers feel. And your heart just hurts for folks that are struggling with this. Surprisingly, this viewer has found that there aren't a lot of services available in Cheyenne. How do you go to a support group when there's no one to care for your loved one? There's no daycare center in Cheyenne. It's difficult to find information about services available in one place. Also, how do you cover the cost if the only answer is to contract with a home care agency? Cost has got to be a tremendous issue. We're aware that Alzheimer's is the most expensive disease in total in the United States. What about someone who may not have resources? What do we tell them? How do we help them?
Was that caller someone from Cheyenne,
That
did you
was.
say? I would just like to always remind people that if they are a veteran, that they should really use the VA system. They are wonderful. In Sheridan, I mean, they really are a resource to caregivers, and whether the caregiver is the veteran or their loved one is, there's a lot of resource there because there's a lot of financial help there.
Again, I think the question is make a call, don't stop searching for assistance and help.
Exactly. And I made these guys promise I was not gonna go on my soapbox tonight, but I'm gonna go on my soapbox for a minute. I love this state. I am a native of this state. I love this state. I came back here to practice in this state because I love our citizens. I love our people here. This is not just Cheyenne. This is Laramie. This is Evanston. This is Meeteetse. It's Big Piney. It's every place in the state. We don't have the resources here that we need. We really don't. And I think part of that is we have a smaller population that is dispersed over greater areas. So how can we get these resources out to people? I can say, when I did my geriatric fellowship in Phoenix, Arizona, in Sun City and Sun City West, and the amount of services that are available to caregivers and to people with cognitive problems, it's amazing. They have these free day centers where people can take their loved ones, and the VA helps, they take the VA patients as well, and there's this and there's that. So I hear the frustration here because these are my patients. These are the people that I deal with and the families I talk to when that we struggle with this. And so the thing I would like to say is things are not perfect here. And what we need to do as a state, what we need to do as people who live here in this state is we need to make our voices heard, that these are the resources we need. If the governor is
talking
working,
about policymakers.
Exactly, policymakers. So the governor is working on his Alzheimer's plan, and that's great. And people can speculate on what we may need this and we may need that. The ideas need to come from the people who are in the trenches, the people who are caring for their wife, their husband, their mother, their father, their grandparent. This is what we need in this state. We need day centers. We need more memory units. We need access to specialists X, Y, and Z, and we need to have people's voices heard so we can affect policy change in the state for the good of all of our people. And when we talk about Wyoming, let's face it, our population's getting older. People are moving here from out of state. We don't have state income tax. So it's, and the cost of living's low. It's very attractive to come here and retire. Here you can buy an inexpensive house and everything's great. So we have older people moving here. We have younger people leaving the state. So what does that mean? It means our state, I think the last statistics I saw, we are on track to be the 5th oldest state in the United States as far as age goes. And that's after meccas like Arizona and Florida, where everybody goes. We're 5th. They have resources and we don't. So we need to make our voices heard. People who are out there caring for their loved ones, you need to make your voice heard, as this is what we need.
And again, the opportunity to do that will be in January and February, when all across Wyoming, there'll be public meetings talking about the governor's plan for
Exactly.
Alzheimer's. Okay. Interesting question, a little bit different than respite care. What happens when someone needs emergency care? This viewer is watching us online, and the question becomes, what resources are available? The question is directly in Cheyenne, but I'll say anywhere. If an emergency situation, if one parent might become in a harmful situation by the other parent with dementia, in other words, something that hasn't happened before, and oh my gosh, I need help this moment.
So if they're violent, let's say if the emergency is the parent with dementia is being violent, they're a threat to themselves or a threat to their loved one. The primary thing is going to be you need to get them out of the situation. And generally what that means is, and I hate to say this, and forgive me, Cheyenne Regional Emergency Room physicians, I love you, you know that. They have to go to the emergency room. It is call 911, have them taken to the emergency room so that they can be detained there, because it's why is this person acting out? Are they acutely sick? Is it a delirium? People with dementia and Alzheimer's, if they have, like, say, a bladder infection or pneumonia or a heart attack, and one of the various things, it can actually cause them to have a more altered mental status. They can become aggressive or confused or lethargic. So the question is there something going on? Is there an acute process that can be reversed? And then second, is this a coexisting anxiety, paranoia, underlying psychiatric issue that needs to be dealt with? And if that is the case, again, as far as I know, we don't have any geriatric psychiatric facilities. We don't have a geropsych unit in the state. Generally in the Cheyenne area, if someone needs to see a geriatric psychiatrist, they are then transported to Colorado, where their behaviors can be stabilized, they can be supervised in a secure place. I think on the eastern side, the western side of the state, I think Salt Lake City may be that resource. And so it is getting them into a safer environment, seeing why is this happening? Is it an acute process that's fixable? Or is this a underlying psychiatric issue, and getting them from
But
there?
if there is danger, don't be afraid to use 911.
Exactly.
And seek some help immediately. What do we know about programs like Luminosity, this viewer from Gillette has asked? What do we know about memory programs? Are they great? If we're 30, should we be engaged, or is it a waste of money? What do we know?
It's a waste of money. My opinion, it's a waste of money. I know
Is there
that they
some research that
I
has-
think that they just had some research published, and unfortunately, I don't have the article available, but I think that is FTC or somebody is actually, the government is actually coming after Luminosity for the claims that they're making that they are able to prevent dementia. Ultimately, if we don't know who's going to get it, we don't know what's going on. Again, the risk factors are getting older. Kind of the conventional wisdom is, if it's good for your heart, it's good for your brain. So you want to get some exercise on a regular basis. That's good for your heart. It's good for your brain. Things like a Mediterranean diet, omega-3 fatty acids, eating fish, eating vegetables, those things are helpful. We know that there are certain things that can kind of help boost our brain without having to pay for something like Luminosity. Socialization with other people. Humans by nature are social animals. And so any interaction, so church groups, hobby clubs, anything where you can go visit with other people is a beneficial thing. Engaging in any sort of activities, puzzles, anything to exercise your brain.
Isn't one of the first symptoms that something may be off is unwillingness to stay social? Isn't that one of the first things you recognize, that people tend to withdraw? I don't remember things like I used to. I can't remember. And then what's your advice? Is it okay?
It may be something that somebody notices first. It may be something that a loved one might notice first. That, hey, I know my dad used to go to the model railroad club meetings, and now he's not going, and he's not going to church, and he's just kind of hiding at his house. And so it may be a sign that something's going on. It may be that they're very profoundly depressed as well. But things where people are withdrawing socially, that often is a sign that something's going on.
That should be communicated to a medical provider and
or at least
again,
addressed
some
with
assistance
the
should be
loved one.
Too, that when you have a disability or if you're impaired, you tend to withdraw and you tend to not be as social. So if you've got some physical disability or some physical issues going on that it's a little bit more difficult to get out, that contributes, I think, to the lack of desire to be sociable or to be out and about. And that sort of perpetuates itself as far as kind of a downward spiral.
Right.
So it's important to encourage your loved one to, let's get out, let's go.
And don't be afraid to continue to go.
Yep.
Yeah, and there's, and in addition to that, though, there's, people can withdraw for, and again, especially here in this state, when the weather's really bad, people have bad arthritis, they're achy, or they're afraid they're going to slip on the ice, or they've, fallen before. That's going to keep people from going out. But maybe they're still talking to people on the phone or something. But there actually are, we have, and again, the Alzheimer's Association has this on their website, and I'm going to let Stella talk about it, is that there's like 10 cardinal signs that that are suggestive, kind of put together that are suggestive that there may be an issue or maybe Alzheimer's going on.
Go ahead, Stella.
Well, okay, well, I actually, it's right in front of me here. Sometimes people wonder, is it normal or is it dementia? And, a lot of times when you ask it, you're thinking, well, probably it's not dementia if you're asking it yourself, but when you're seeing like normal aging, sometimes forgetting an appointment but remembering it later, versus completely forgetting totally that you even had the appointment, that you even went somewhere, maybe confused about the day of the week. I mean, we all do that. That's normal. But it's not normal to lose seasons. You mentioned, I mean, if we're talking about Thanksgiving and it's in July, or, there are like 10 things that we try to share with caregivers, because there's so much denial, I think, to this disease. Do you agree with that?
I think so, yeah.
And I think that's another reason why people don't want to get out. As their world is shrinking, they're more and more uncomfortable. But if they're used to doing something, and if that caregiver, one of the questions that we have with the aging division when we do an evaluation, are you embarrassed of that person's behavior? And that question's asked for a reason, because if you are a caregiver and you're embarrassed of going to a restaurant, you too are pulling back more and more. So that socialization is being less and less. So we really show these signs of dementia, and I think when they when they see a physician, when they seek any kind of support, the Alzheimer's Association really has some amazing.
Let me throw this out there for everyone. It is Thanksgiving time, and families are going to be getting together here in the next week. These are difficult conversations, but what should we talk about? What are some things that, if we've noticed, maybe mom or dad might be having a little bit of differences in their personality, or if we're concerned about, what our mom and dad, you're 40 or 50 now, but you're aging, what conversations might be good to have at this time of year?
I think it's always good to be open with your own children. I've been pretty open with my daughter as far as what my preferences are. If, I get to the point where I'm forgetful or I can't take care of myself, we've talked about this. I think, our parents, at the time in their life, it wasn't something that was openly discussed. I mean, it was just sort of kind of shoved under the carpet, I guess, if you will. And so, now we're having to make up some time in having those difficult conversations. And so, when someone has dementia, it's almost too late to talk about, what do you want, Mom? What do you want, Dad? What is your preference? Do you want to go to a nursing home? And it's just difficult. It's too late. And so, having those conversations earlier than later is always best. But I think, during the holidays, you want to be in the moment with people. I think you want to be in the moment with your family. And even though they may be or may not, to celebrate the time that you are with them, I think.
Celebrate the moment?
Yeah.
Well, let me ask this question.
Maybe I didn't answer
Because
the
it's the
question.
holidays, is this the wrong time to have these discussions or
No.
not?
I don't think there's ever a wrong time.
Mm-hmm.
And I think sometimes it really depends on the family dynamics. I mean, there are some people that come to support group that they do not want their person to know that they've been there, because they're so afraid that, it really depends on the family dynamics. If you're an adult child and that's never talked about, that's not a conversation that's easily started. But if you're noticing something, and if, I don't think there's ever a wrong time, but I also feel like as the holidays are coming upon us, everything is supposed to be merry and bright. And so are you going to be the the Debbie Downer to bring up these things. I mean,
But
there's-
really, is
you're
this a Debbie
not.
Downer question, though? Is this, if we're concerned about quality of life and issues that really matter, is,
It's never a wrong time.
Yeah, and I think that's important. And actually, I think I bring this up with a lot of the people, a lot of the patients, and a lot of people I work with. I've got a lot of very young, healthy 60, 70-year-olds, and I mean, really, their probability of something happening is low. But there's a probability they'll be in a car accident. That's something that can come up, and they could be very seriously injured. What would they want? Who should talk? And I always ask them, if you can't tell me what you want, who do I need to talk to? Who do you designate? Designate one person who you know is going to do what you want. I recommend to everybody, get formal advance directives. You can always change them. Right now I want everything done because I'm 60 and I feel great and I'm running marathons. But you can change that over time. But make your wishes known. Would you want mechanical ventilation? Would you want a feeding tube? Those things are important. Start planning financially. If we are living longer as a society, and so there's a probability you're going to live to 80, 90 years old. If you're not able to stay in your own home, what are you going to do? Look into some long-term care insurance. Set up a trust. Talk to an elder lawyer, someone who specializes in elder law, and get these things down so that it's all taken care of. Because the thing that's the scariest is there's a crisis, something happens to a parent, and the adult children are like, what do? We don't know what to do. Whereas if it's spelled out for them, this is what mom wants, she wants X, Y, and Z, they can make those decisions comfortably.
so even if it's a conversation that's difficult to have, perhaps they can get things written down so that
Yeah.
the siblings might have a sense. You mentioned long-term health insurance, long-term insurance. What is that, and is it worth it? Because my perception is it's very expensive. What can it provide us?
So with long-term care insurance, it's an insurance policy that you would pay into over many, many years that you would be able to tap into later down
When
the
do
line.
people usually start these?
As soon as they're admitted to like an assisted living facility or like a skilled nursing facility, it's like a nursing home or assisted living, and I think some policies will even count for, will help cover for home care.
No, my question was,
So-
at what age should people really consider starting to purchase this insurance?
Earlier the better, 40s, 50s.
And do
buy 'em when
people
you're
really do
younger.
this?
Not as many, not as many. And this is it's very expensive. Getting older and needing more care is highly expensive. So if you've got that to help offset the cost.
There are
that's a good
people
thing.
out there watching tonight, now Medicare will take care of me, I'm good.
No.
There's Medicaid programs, I'm set.
Nope.
You're
And
shaking your
The older
head.
you get, the higher the, so if you get your long-term care insurance when you're 40 versus when you're 60, your premiums are higher. You may pay longer in the long run, but if there's some people that I, with the caregiver groups that they have long-term care insurance. I see more elderly people have long-term care insurance than the younger ones. And they've had them for a long time, but they don't want to utilize them. They want to wait until they need them. And when they're in their 80s and 90s, it would be time now.
Yeah.
Because you've paid into it.
Ultimately, cost is, when you're looking at assisted living facilities, you're looking at a minimum, $2,800 a month, $2,800 to up to probably $5,500 a month for assisted living. Skilled nursing facilities run $6,000 to $8,000 a month. So you're paying into these things. It's actually going to keep you from having to sell your house and liquidate all your assets to pay for your care.
Couple questions that I want to get to real quickly. A caller asked, what is Luminosity? And it's my understanding that it's a program that you can have a different brain exercise every day. The theory is that the more I exercise my brain, the less maybe that I'll be susceptible to dementia or Alzheimer's. Unfortunately, the research is showing that may not be true.
Exactly.
It's something that you subscribe to and can continue to
Great
pay.
for puzzles. It's probably some great puzzles.
There
but
might
as
be some
far as
entertainment value
exactly,
in it, perhaps.
entertainment value only.
Or something, there you go.
But as far as like staving off dementia, yeah.
Another question, and this gets back to the science thing. Are there medications that can really be effective in slowing down the disease? What do we know today? How do those work? Are there side effects?
So this great question. There's a great question. So the good news is, yes, we have medications. We have 2 different classes of medications that we can use as roadblocks. They're going to slow down progression in most people. They work on 2 different neurotransmitters in the brain, so that you're altering brain chemicals to help slow down the disease process and the memory loss itself. The problem is that we know with Alzheimer's, there's several different things going on at once that are destroying the neurons in the brain cells. And when they're looking at different drugs to try to stop it, they're targeting these different things, and they can stop this particular process, but unfortunately, it doesn't stop the memory loss or the disease process itself. So we do have 2 classes of medication. They do slow down the progression. Most people get a benefit. There's a small subset that don't see any benefit at all. As far as side effects go, one particular class can give you some nightmares and maybe some upset stomach, which can lead to weight loss. The other one, there can be some agitation and, again, nausea, vomiting, diarrhea. But both of the classes are pretty well tolerated. And again, it's going to buy you time. It's going to buy you time. You want to try to get them on
We're
early.
talking maybe weeks, months?
So data says that one in particular, Aricept, that's out there, that it works to block the breakdown of a certain chemical in the brain. Data says 6 months. I've seen people do great on it for years. And so physician will be able to say, yeah, you're still doing great on this med, we're getting a benefit. But if there's no benefit after a while, you'd want to discontinue it.
We heard at the very top of the show in the video we saw about clinical trials. How does that function? People just say, you know what, I've got to try something. Can people in Wyoming participate in clinical trials?
Yeah, as far as I know, there aren't any clinical trials going on currently in Wyoming, and there may be, Jackson may be one of the places to look there. They have a great center up there for cognition. It would be looking at things like University of Utah, looking at Salt Lake, looking at University of Colorado and Denver. Those larger institutions generally have ongoing studies. The other thing would be just to get online and take a look. Things like Banner Alzheimer's Institute, Barrows down in Phoenix, it's a neurologic institute. Those sorts of places, the big centers are going to be where they want to look for trials if they're interested.
We had another caller with a great question. Her husband and she cared for his grandmother. A statement here, part of the problem is caregiver is a feeling of guilt to ask for help. But then something else, they did this for 4 years. The question is, how can I get trained to help others? There's not that support here in my community. We don't have a lot of resources. I want to help. I want to get some training, and I want to help others be able to provide support.
I think Linda touched on that earlier with the University of Wyoming. They have some excellent programs that are out there.
Do they provide training?
They do. So
This is the Department of Aging.
Yeah,
No.
the University of Wyoming Center on Aging.
Center on Aging, excuse me.
It's the Wyoming Center on Aging. My recommendation would be to give them a call but check them out on the website first. I think probably too, with the training is to volunteer your time in senior centers, the programs across our state that are offered through the caregiver program such as Stella's. There's the National Family Caregiver Program offers support groups and assistance to caregivers throughout the state. It's so worth the call. Probably the best way to reach or to identify ways or locate where caregiver programs are is to go to the Department of Health website, to the Aging Division, and the caregiver program, National Family Caregiver Program, will list the communities where there is a caregiver program. I don't have a list in front of me, but that would be my first recommendation, because the federal government supports these programs through the Older Americans Act, very similar to the home delivered meal programs, the congregate meal programs across the state. Every community has congregate meal sites. Not every community has a caregiver program. Not every community has the resources or the workers that can provide that type of care. And so it's really unique to the community and what their needs are.
But I think the takeaway from this, though, is if someone's interested in making a difference in their community, there's
Volunteer their
opportunity.
time.
and the Aging Division.
Volunteer their time in the Senior Companion Program.
Absolutely.
Senior Companions are an excellent way to be able to extend yourself to a senior in their home, whether they need transportation, to that individual
And there's some
itself.
training involved to help someone learn.
There is, the Senior Companion provides that, but that helps the person that is the one with dementia. That ultimately helps the caregiver. So
Panel, we have about 2 minutes left, and what I want to go
we could
around the
spend
room.
another hour.
And it does go by quickly. And Linda, let me start with you here. Just a quick summary maybe of the things that you've talked about tonight that you want to reinforce.
I think what's really important is for caregivers or family members to reach out. Don't hold in. Get help. Everyone needs somebody to talk to, whether it's a friend, your clergy, or if it's an organization in your community that provides in-home services, such as the Wyoming Home Services Program, the program that I work with. We really try to keep people safe in their homes by providing services around the state, funds to communities that can help provide in-home services such as personal care and homemaking. But really reach out to these programs. That's what they're for. You know, the more they're utilized, the more it demonstrates the need. You know, I always encourage our programs to say, be sure you use that waiting list, because the waiting list tells the story.
Stella,
So,
we have a few
reach
seconds,
out.
and thank you, Linda, so much. Stella, the conclusion?
Conclusion, pretty much what Linda said, reach out for help. Caregivers, I mean, really reach out for help. It is very difficult to navigate this system on your own, and you are not alone. If you reach out, you will find out that you're not alone.
Dr. Johnson, talk to policymakers?
Policymakers, yes, make your voices heard. If you live in this state, let the state know what you need as a caregiver, what you need as a family. That's like the most important thing. And if you think that there's something wrong with your loved one, if you suspect they have a memory problem, please get them evaluated by a physician so that they can get, if there's something going on, they can get treated earlier and get them some time. So.
I want to express my thanks tonight to Janet Lewis, who's behind our cameras this evening, for her work. She's the Executive Director of the Alzheimer's Association of Wyoming. And Janet, we're appreciative of your efforts that has helped us tonight. As we conclude our program this evening, we are showing you resources where you can turn for help. If you need more information about dementia and Alzheimer's, and as we've learned tonight, there are places to turn to for that help. Also, we want to say a big thank you to the Episcopal Diocese of Wyoming, who is hosting us tonight here in Casper. We originally planned to have the show live at the Deer Trail Assisted Living Center in Rock Springs, but because of weather, we're here. But to both entities and to all of our viewers, thank you and have a good evening.